I've worked with so many different people just in the past few months, from people that are dealing with neuropathy. I've got people that are post-op knee surgery, hip surgery, shoulder surgery, people that are dealing with major issues with lower back problems. Recently, I had a young lady that had a hamstring tear, and it locked her up pretty good to where she couldn't move. What was so fascinating about it was how fast the recovery was for her, and how we actually had her going through the movement that she actually went through when she hurt herself, when she actually hurt her hamstring, in order to make the corrections, so that now she is out playing tennis like a beast.
Wow.
And it's phenomenal just to watch how much she's improved, how fast.
This is all about the movements, and this PRS is so adapt for that.
I've got clients that all use the device while we're training so that they can just continue. And this thing is completely maxed out. They really don't feel anything, but they're getting this massive amount of circulation going through their body. But what I've noticed at the same time, in those areas where they actually had the issues, while we're training with the ARP device on, there is absolutely no pain, no discomfort. Their form is better, right? Their technique is near perfect. And they walk away from it like, what just happened? You know, I should have been in major pain. So, I mean, that's just one small example of how this technology is really working for people. It's pretty amazing.
Eric, when you mentioned that when they're going through movements that their form was better, did you notice that when they were on the blood flow feature?
Yes.
Why do you think that's the case?
Well, I think they're getting that massive amount of circulation at that time. You know, and that contraction is sustained in the muscle. So I think what's going on is it's rerouting everything and just allowing the body to work the way it should. The nervous system and the muscles to actually realign and work the way they should while it's healing at the same time.
Have you been doing other like modalities with it? Any forms of exercise you've been using with it?
Let me give you an example of how I actually use this with, I had mentioned a gentleman that had just had a botched knee replacement. We were trying to get him back to zero with his knee. It was nearly impossible because of the pain. You know, obviously we have to move him to get him back to zero. But once I started implementing the ARP device, it literally went within a week that we were actually able to get him to zero, because there was no pain for him while he was going through that movement, which is normally, if anyone's ever actually had a knee replacement, trying to get that knee back to zero is extremely painful for most people. But I mean, this was just an absolute shortcut. And then what we did after that is we actually started using it for therapy exercises. We would go through basic squats. You know, we were working, when he actually left to go back up north this season, we were actually working on his hamstrings as well. But it's night and day recovery.
Have you been able to use it with anything beyond just like the workouts? Have you incorporated it with yoga or massage therapy, anything like that?
Yes, actually, Jake, interesting that you asked that. Yesterday, I had a client, a 90-minute deep tissue massage session. He was dealing with some major sciatic and low back issues. ARPed him up while we were going through the therapy. And then by the time we were done, he was $1 million.
Wow.
And it was a 90-minute session. That's it.
Wow.
That's fascinating. This was during the massage therapy session.
Yes. Yeah. While we were doing massage therapy.
When you say ARPed him up, did you have a specific pad placement, or
Yeah. I actually had the pads on his laborums, which is the lower back it's And then we actually went down to the sacrum.
Got it. Okay.
So we placed here and here. And pad placement is a big deal for this. That is one thing that I have really been studying. If you don't get the pad positioning correct, you might need to do it a few times before you do. You know, don't give up. You can do it. But I'm finding that there are people that have already came back to me that have one of these devices that need help with placement. For example, I have a young lady that has neuropathy. I'm placing them right on her feet.
Okay.
Literally both pads directly on her feet from the heel up. By the way, her neuropathy, she is actually starting to get feeling back in her feet.
Yeah.
Now, the feeling that she's getting sometimes, she's like, okay, it's like I can feel my feet again. I'm getting certain little pains here that it was completely numb. I could feel nothing for years. So what's fascinating is that now she's literally starting to feel her feet again.
Yeah.
Another example, I was using it and testing it with a friend of mine that has arthritis in his hands. Obviously I didn't put the pads, the electrodes right on his hands. I put them on his flexors, extensors. Now, if you do this and you get a little too close, it's going to make your hands contract.
Yeah.
Right. Have you seen, I'm sure you've seen it a million times, Jake.
Yeah.
But again, that's could be correct placement as well.
For sure.
Arthritis in the hands. I'm seeing results with this as well.
What are some of the biggest misconceptions that you think that you may have had, or that others may be coming in, some of your clients had, regarding the ARpneuro technology?
Absolutely. The first misconception, I'll tell you, I have a feeling that the majority of people that are using this technology will say this. First misconception, they think it's a TENS machine.
Yeah, for sure.
They think it's a TENS machine. And so when you actually look at it in comparison, a TENS machine only hits, it's an alternate current, right? So it only hits about, I think 35% of superficial muscle.
It's probably, yeah, probably around that. Yeah. It's not getting cellular level for sure.
Yeah, it's definitely not going all the way through. So, but I think that that's a big misconception that most people think.